Good afternoon, everyone. Welcome to our Frantic PC COVID webinar. Before we jump into our COVID discussion today, we want to take a moment to say Happy New Year to all of you. We know how hard you all worked last year, and 2021 is already shaping up to be an eventful year itself. As always, we at Frantic are grateful for your leadership and service in the realm of education, and we look forward to continuing to partner with you for whatever challenges we may face. So this week, as you know, our webinar is New Year, New Expectations. What's old and new with COVID in 2021? I'm Jackie Godapur-Werns, and with me are the Frantic COVID team members you've come to know and trust. We have Shelly Anderson.
Hi, everyone. Happy New Year.
Nikki Baser.
Hi, everyone. Happy New Year.
And Jennifer Smith.
Happy New Year.
Before we begin, normal housekeeping. As always, please submit your questions today using the Q&A function in Zoom, and we will do our best to answer them. If you have any follow-up questions or would like to discuss any of these issues further, contact any of us or any other Frantic attorney. You can also always send your questions to covid@frantic.com at any time, and we use those to incorporate into our webinars. Also, please mark your calendar for next week's webinar. We are very excited to be launching our equity webinar series next week with special guests, Dr. Marcus Campbell, Assistant Superintendent and Principal at Evanston Township High School, and Dr. Devin Horton, Superintendent at Evanston-Skokie School District 65. And we're going to be talking about how school districts are addressing racial equity. If you haven't heard about our equity series, please make sure you're signed up to receive our Frantic email alerts. And you can always email us at events@frantic.com to get signed up for alerts, or head over to our website to do so. And while you're there, make sure to check out our many other alerts, blogs, podcasts, webinars, all the things we do as far as free resources for school leaders on the full range of school law topics. All right, so with that, let's jump into discussing New Year, New Expectations, what's old and new with COVID in 2021. So first of all, with everything going on in our national government yesterday and last night, we know that many of you are probably thinking of little else, and so we thought that would be a good place to start. So Congress ratified Joe Biden's election victory after a day in which individuals stormed the Capitol. President Trump issued a statement saying there would be an orderly transition on January 20th, and it appears that the Democratic Party will have control of the House and Senate. So let's start with a discussion of the election and what impacts we think there may be on COVID as a result. Nikki.
Thanks, Jackie. And, we know that everyone is shocked. It was shocking. All of us were glued to our news outlets last night. We're all still processing this. And, certainly kudos to our educators out there. I know that this is yet another example of a difficult conversation that you're going to have to navigate your students through. And we appreciate all your efforts. And we're all doing that with our children at home. And we know it's so much more difficult to do it to a classroom of students. And again, we're happy to talk through those issues with educators and with administrators if they're helpful. Obviously, what we do know, and Jackie, you referenced this, is that after January 20th, there are going to be significant changes to the landscape. Now that the Democrats have essential control over both houses of Congress, we're going to likely see more significant legislative changes than we had potentially anticipated. The agenda that Biden has is a large one. It's aggressive. And so again, the odds of a lot of those key components of those passing has grown significantly based on the election in Georgia. Things are going to change. That is a virtual certainty. It's depending, how those changes come about, what those changes are. I don't know that we can fully anticipate right now, but what we can definitely bank on is significant change. One of the things that I think we're still looking at and know is going to come down the pike is, stimulus money to individuals is likely to increase. I know Biden has indicated that the current stimulus is just a down payment on what he sees as necessary. We may also then see increases to the aid that are coming to states and local governments, and potentially to school districts as well. So, those are things that are on the horizon. And then obviously following that, some potentially substantive, and I think Jennifer's going to talk a little bit about the Secretary of Education, or we're going to talk about the Secretary of Education later in the webinar. But, then the sort of policy and substantive changes we're likely to see thereafter. I do want to just note in terms of stimulus, specifically that ISB has put out information on the specific allocations of stimulus funds. And so we would call that your attention to that. Beyond that, it's sort of a wait and see at this point. And again, expecting significant change, just waiting to see how that all plays out. I do also want to just note that we are also about to enter into a legislative moment with our state legislature, and we are likely to see maybe potentially not COVID related, but other significant changes, at least on the ed front there. So that's something to watch as well.
So on that same line, regarding the changes at the state level, one of the things that we've been talking about quite a bit in the past few days were recent updates to the Illinois Department of Public Health, or IDPH, guidance for schools, and along with ISB, on issues like quarantine and vaccines and testing. So let's talk about all of those. So Jennifer, can you take us through the new changes to the IDPH guidance?
Sure, Jackie. So just to start with, the biggest change probably is around the quarantine period for close contacts. And I'll start with the justification they gave, because I think it is kind of interesting. There's still the recommendation, the gold standard, so to speak, is still a 14-day quarantine. But they give information about the acceptable risk, and that you're somewhere between 1 and 10% or 5 and 12% if you use one of two different options as a quarantine period. So you're at like 1% if you do the 14-day, but somewhere between 1 to 12%, depending exactly, is the risk if you use one of these two others. So they're not recommending the two others, but they talk about the idea is if you get increased compliance, voluntary compliance, then it's overall has a better effect on preventing COVID than a more strict, longer quarantine that people don't comply with. So getting then to what the two new options are, one is a quarantine period for 10 days with no symptoms. And so that would be just shortened from 14 to 10, but again, no symptoms. The second is a quarantine for 7 days after the last exposure if there's no symptoms and the individual has a negative COVID test within 48 hours of exposure day 7. So basically, and that option is only available for adults. So it's a shortened 10-day from 14 that's available for kids and adults, or a shortened to 7 with a test, basically available only to adults. So those are the new options that are given to local health departments, again, with the idea that there'll be greater voluntary compliance. So it overall would be potentially have a better impact. Do you guys have any thoughts about what you're seeing on those changes, or if you think those are going to be big changes?
I mean, I think, from my perspective, as you mentioned, we're in a waiting game. We're in a waiting period here because this was a recommended change for local public health departments. They get to make this choice. And so we all just have to be in a little bit of a waiting period to see what happens there as far as whether these are going to be implemented. It was also interesting that, repeatedly the IDPH guidance referenced the fact that this is not antigen testing that we're talking about here. This is testing for COVID, and that we shouldn't be using antigen testing to use these shortened quarantine periods, even if they are authorized. I don't know if anybody else has thoughts on that.
I mean, the only other thing that I've been a little bit scratching, it's a little bit odd to me to give the option. I was thinking about why would one give the option to the local health department? And the only thing I can think of is that part that they stress about if voluntary, maybe where there's areas where you know you're not getting voluntary compliance with the 14-day, then and a local health department might have a better pulse on whether that's true, and that this would actually increase, health in your area because you increase voluntary compliance. That's a better call locally than for statewide. That's the only thing I can think of. Otherwise, it's kind of just interesting to kick it to the local health department, right?
We did get an interesting comment in the chat indicating that at least one local health department has indicated that they plan to use the 7-day shortened period for students as well. And so if you look at that IDPH, the revised language, it says we don't recommend that you use this with children. We recommend that it be only used for staff. But like most other things in the guidance, it doesn't say you can't. So it seems that at least some are going to be moving in the direction of using even the shortened option for children. So Jennifer, there's some discussion in the revised guidance about documentation. So can you just talk us through what kinds of documentation schools should be seeking after these quarantine periods end?
Yes, so the guidance is saying that you do not need a note if you do the full quarantine period and there's no symptoms. Less clear in the guidance is whether you should require a note, and it seems like the answer is probably yes, although it's not that straightforward and it's not stated that straightforward in the guidance. But if a person has symptoms and that's why they're quarantining, then probably yes, you do need a note to resolve the quarantine period, although a little murky there. And then for those who do the shortened 7-day with the test, it does talk about requiring documentation of that negative test and confirming what the appropriate time periods are. So you do need information and documentation in order to do the 7-day.
So there's obviously a fair bit of information in these new IDPH guidance documents. So one other thing I wanted to ask about was the references to travel restrictions. So Jennifer, can you talk to us about what do they say about travel restrictions in these updates?
Sure, and I will say, I think the new travel restriction section is very confusing, and I made these ladies read it with me several times to try to tease out what it is they're talking about, because it still continues to recommend, it does not recommend a 14-day quarantine for basically all high-risk travel, and basically everywhere is high risk these days. Although I don't know, Nikki, I think you told us Vermont, or there's a few places that weren't, that the last time we checked, but basically everywhere is high risk, and they're recommending 14. And then it says if you do particularly high risk activities during international travel, then these additional things also apply. But the additional things seem to give a giant loophole to the 14, because that basically says you can test out of the longer quarantine, and that the maximum that you'd have to quarantine is 10 days. So I don't know why, but it makes it sound like you have to do both the 10-day within the 14-day, which obviously that makes no sense. So we think the better reading of the new language is that there's a reduced quarantine period, that they're approving of a testing with a reduced quarantine period, or a 10-day instead of a 14-day, although that's definitely not straightforward in what it says. But I think that's what I take away from it, that maybe you could do those reduced quarantine periods after travel. I don't know, Jackie, I know we teased this out together, and I know you just traveled, and you're going to do the 10-day, not the 14-day.
I am. Well, after reading it, I'm giving myself, I'm out at 10 days. I think that that's what they're saying, particularly for individuals who don't engage in high risk activities with travel. And we're going to talk a little bit later with Shelley and Nikki about how we want to encourage honesty, and that, as you mentioned, Jennifer, this guidance has a lengthy section about how all of this is really intended to help people make the right decision of sharing information. And so if telling someone that they only have to stay home for 10 days if they don't get a test or for 7 days, if they do get a test, helps people be honest about their travel, then it seems as though that is recognized as a win. So yeah, it is confusing though. We definitely parse through it, and it's not clearly written, but I do think that what Jennifer described is the most appropriate interpretation.
Yeah, and I'm sure you guys are getting these comments or questions too, which is, since it's unsafe in areas of Illinois, what is the difference between someone who has decided that they're, going to go to a restaurant or somewhere where things are open in Illinois versus someone who does that across the border or travels but is safe? I mean, I think that this is really the struggle right now, in terms of, coming up with policies that keep folks safe in school buildings, while, as you said, Jackie, encouraging folks to be honest and also keeping your buildings staffed appropriately. And I don't know that there's any easy answers to this. And I don't know that this particular guidance, while we appreciate IDPH is coming out and continuing to provide guidance, I don't know if it solves some of these bigger sort of issues in terms of how you address the fact that at one point there was spread in certain states and now it's just sort of everywhere and all around us at the same time.
Right. We've all talked about, I mean, for example, we have a colleague who went just over the Wisconsin border for a half-day ski trip with her kids. But being the extreme rule follower that she is, she reported it, she got tested, she's now quarantining her children and keeping them out of school. And it feels a little silly given that one could go into a crowded bar maskless and then send their kids to school. So, some of it, I don't know how far to take, and you want to be a little bit reasonable, but, I think there are people that are trying to be following every single bit of guidance. And so it's important to try to understand what is the guidance.
So we'd love to hear from any of you in the chat. How are you planning on dealing with this? But I also just want to ask the panel, how are you seeing districts handle this issue as everyone is returning from break?
Sure, so I'll get us started with this. I mean, I think that many districts that we work with had sent out notices to parents before winter break, reminding them of the need to prevent community spread, and that one way to do that was to limit travel and to be mindful of that. And there are others who went a step further and said, if you are going to travel and you engage in high risk activity, which could be considered on an airplane, I'm not sure in certain instances, to consider quarantining for those schools that are back in a hybrid model. I'm unaware of any districts that I work with that are actually mandating it, to saying that if you travel, you have to go to a remote plan. I know that there are districts that now, the guidance came out on the 4th, and many of our districts went back on the 4th, that are asking it on their self-certification question, to add a question that says, have you traveled and have you engaged in high risk activity, and then recommending the specifically the quarantine and the testing that's indicated in the new guidance that just went out. But I have to say, going back to what I think, one of you had just mentioned, this idea of excluding students who perhaps engaged in safe behavior outside the state and not excluding students who engage in high risk behavior in the state really does not make a whole lot of sense to me. But then you have to be asking everyone these questions, which becomes, very difficult to manage. And then the other piece of it that I'd love to hear, maybe Nikki, your thoughts on, is how we manage this with respect to staff. Because, while we're asking parents to be truthful about travel and high risk behavior, they may have an inclination to not be as truthful because they want their kids in school. On the flip side of it, for those teachers who do not feel comfortable coming to school and yet their school are still in a hybrid environment, we also need to deal with the staffing issue. So if we were to say to all staff who traveled over break, you have to stay home now. The question is, how do you manage that, right? You can't now say, we're going to make you take your benefit time if we didn't tell you that in the beginning, that was going to be the result. And you might not be able to continue with in-person learning if you have joined anybody to staff that classroom because that teacher is now going to be remote. So Nikki, I don't know if you've seen that issue come up also.
Yes, definitely. And I know some districts did send out letters similar to what you were talking about, Shelley, in advance of break. And actually, I do have a couple of districts who have just implemented a policy that if staff has traveled, they have to stay home. It creates all of the issues that you're identifying, Shelley, which is that if they don't, if the teacher can remote in and they have staff that can serve in the school building, that's great. If they don't, it forces more remote learning, and it definitely is stymieing districts that are trying to get back. On the flip side of that, of course, is that, you know, districts who are open are trying to do everything they can to stay open, which means making sure that they're safe. And so I've seen a variety of responses, everything from we're going to mandate you quarantine and we're going to provide you with leave to do so, to, you know, we're just hoping that people are making the right choices, and if they choose to quarantine, they can. Again, I think there are pros and cons to both approaches. And I know we're going to talk a little bit later in the webinar about, you know, leave issues, you know, following the expiration of Ffcra. But I think that this dovetails with that, because obviously you want your staff to be honest. You want them to, if they've engaged in behavior that could expose them to COVID, not to come into the school building. And you want them to report that, but then you also have to staff your school buildings. So again, no easy answers, and I've seen a variety of responses.
All right, so I know that I at least have been excitedly thinking about the idea of vaccines, so I'm sure that many others are as well. So we obviously have been hearing that vaccines are possibly going to be rolled out and distributed to schools, some schools as early as this month. And this week, the governor and Idph announced that Illinois teachers will be next in line to receive the vaccine in Group 1B. So Nikki, tell us a little bit more about what we're hearing about vaccines.
Yes, and of course, this is great news and exciting, and we're all impatient for the vaccines to roll out. And it was certainly great news to hear this week that in some of our counties, we are seeing, again, vaccines rolling out as early as this month, next month. I think there's a number of different moving parts to this, and I know we're going to try to navigate through some of them. I want to start with the issue that arose this week that we heard about, which is that some of the local public health entities are going to be asking districts to be vaccination points. So they are going to actually have school districts administering vaccines to their teachers. So I think that there's a number of issues that arise because of that. I mean, again, great, wonderful, let's do it, but let's do it in a way that's smart, right? So the first thing I think we want to talk about is at this point, my understanding is that most districts are not going to be mandating the vaccine. So the idea is that they're not going to mandate that the teachers get vaccines. It's going to be optional with the hope that most teachers comply, and that's our expectation. There are certainly issues with mandating vaccines. You know, our legal read is that it is likely that you can mandate vaccines as long as you do provide exemptions for religious exemptions or medical exemptions. But you do, you know, obviously if you have collective bargaining agreements, you're going to need to sit down with your unions. And I know, and, you know, Shelley, maybe you and I can talk a little bit more about that in a moment. So there are the issue of, you know, who has to get the vaccine and when. But assuming that you are not mandating at this point, but you're just going to be administering vaccines, there's a couple of pieces to that you need to think about. The first is the employees that are administering the vaccines. So presumably those will be your nurses. Likely your job descriptions are broad enough to encompass your nurses administering vaccines in your school buildings, but that's something to look at, to think through, and it may be something that you're going to need to address with unions. With your unions, if it's the support staff unions that some of your nurses are in, or if obviously your CSNs likely are in your teachers union. So that is one piece of it. The other piece of that, just to keep in mind, is that while all nurses in Illinois can administer vaccines, there are some levels of nurses that need to have that authority delegated to them by a higher level not higher level, but a different credentialed healthcare professional. So that may be something that your nurses bring up, and it's something that I think can be remedied, and we'll talk about the remedies. The second piece of it is wanting to make sure that school districts have full immunity. Let's say someone has a reaction to the vaccine. Can they sue the school district? Those are issues that what we talked about related to testing. Obviously, is increased with vaccines, right? Because with testing, you might be sticking a nasal swab up someone's nose, but you're not injecting something into their body. So one of the things that we want to be really careful about is that we make sure that districts are covered by any state and federal immunities that may be available. In this case, most important is going to be PrEP Act immunity, which is federal immunity. We talked about this a couple of webinars ago related to testing, but it is a federal law that provides almost complete immunity to a school district in this case that are administering countermeasures that relate to a specific health epidemic. So the piece about the nurse delegation and the piece about the PrEP Immunity Act lead us to the conclusion that what districts are going to want to do is make sure that they have a clear agreement, an intergovernmental agreement with the county health department related to this administering of vaccines. So I know we are already working with DuPage, talking with the ROE and some other folks there about how to facilitate this. So we're not getting, every district is not having to deal with this on their own, that we have sort of one master. This is going to come up in other counties as these vaccines roll out. And we think that this is an approach that we're going to want to think through, again, just to make sure that we've got our nurses covered and also that we've got all of our immunity protections in place. So that was a lot of information, a lot of moving parts, but I think the takeaway is that if you are being approached by the county health officials to set up vaccination programs in your schools, that's wonderful. But we want to make sure that we have just the right components in place to make sure that everything is covered so that the district is protected, your employees are protected, and that you run this program effectively. So that's sort of a little bit of a nutshell on vaccines at this point. And Shelley, I don't know if you have anything else on the mandating piece or.
Yeah, I mean, I think that I know of at least one district we work with that I believe their vaccines are going to be provided to teachers. I think next week is when they're going to start. So it's early. And when I spoke to the superintendent about, whether he expected compliance or not, he felt that it was not necessary to even go down the mandated route because the expectation, they're a school that is in school virtually, I think 5 days a week. I don't think it's all day, but that the bottom line is that you can get the vaccine and we're going to provide it here at school for you to get, but either way, you're expected to come to school and perform your job as a teacher. So he felt that in that instance, there was no need to mandate it, that most teachers would get it, but that whether they did or not, the expectation is still that they come to school. So I'll be interested to see how people, different districts respond to that. And it'll also be interesting to see, I imagine it's going to be, some percentage of teachers that do not want to get it, just like other vaccines that we have currently. But I would likely think that there will be many more who do avail themselves of being in that kind of second tier category of 1B to get the vaccine.
Yeah, we've had a couple questions come in too about this that I just want to address off the bat. The first is, what are the HIPAA implications? I guess I'm not exactly clear on the question in terms of the vaccinations. Obviously, HIPAA relates to documents. It relates to the submission and the disclosure of documents. Obviously, vaccine administration should be done in a confidential way, in the sense that, you should be talking with staff about it. I don't know what documentation is going to be provided or developed related to the vaccinations, but obviously all medical documentations related to staff should be kept confidential, and medical records have to be kept separately. All of the medical records that you receive as a school district, so your FMLA documents, any ADA requests, all of those things have to be kept separately. So if there is any documentation generated regarding the vaccine that you would have to keep, it would be kept separately in your medical documentation file for your personnel. I'm not certain that there's going to be any submission of documentation that would have HIPAA implications, but that would be something certainly we would discuss with the local public health officials in terms of what documents are going back and forth and how are they being conveyed, and are there some confidentiality issues that arise that are HIPAA related, and then we would need, to put in place the correct documentation.
I'll just say, I just pulled it up just to remind myself of when it was, but if people are interested, we do have a great alert on our website from February of 2020 about HIPAA, the HIPAA privacy rule, and when it applies to schools. And I am frankly shocked to see that date of February 2020, because I feel like we put out that alert 3 years ago, but it is, it's there, it's very recent. So definitely check it out if you're interested in learning more about the interplay there.
Right. And then Shelley, I don't know if you have any thoughts on this one too, but I'll start us off. There was a question that came in. Can you hire a nurse through a temp agency to administer vaccines to staff? Obviously there could be some, I mean, you certainly conceivably could do that. There's going to be some labor implications, presumably. If your nurses are in your unit, hiring outside folks to do this may bring up issues, but that may be something that you're going to sit down and talk with the union about. They may be supportive of that concept, at least on a temporary basis.
Yeah, I think if you're just hiring them in just to do the vaccinations and it's just a benefit, I mean, I guess that I would be curious. I don't think it's really going to be hiring them as much as it is contracting with them to provide this benefit and the service to staff. So certainly, like all things, I think you should be talking to the unit about it, especially if, there are nurses in the unit, and making sure that you're clear about that. And I think there'll be some units that don't feel that giving vaccinations is within the job description itself. So you need to have someone else come in and do it. So I think that we'll just see how different districts handle that as we move forward with this.
Right. It raises one other question that I got about this, which is that there are some districts that already have nurses through agencies. They are employees that they employ full time, but they do it through agencies, or their co-op does it through, they get them through their co-op, but they are employed through agencies. In those instances, you're not looking at a job description, you're looking then at the contract that you have with the agency to determine whether it's within the scope to have them administering vaccines to employees. If not, it's just something that you're going to need to negotiate with the agency. And it may come with an additional cost. I don't know, but if that's an issue, then we should take a look at your contract and make sure that you have that flexibility.
So we did get a question in the Q&A that's a great segue into our next topic, which was, what happens if a staff member doesn't want to take the vaccine, but they want to keep working remotely and they want leave for it. So let's talk about the Ffcra. So we know that as the year came to an end, that there was a lot of debate and speculation about whether or not the Families First Coronavirus Response Act was going to be extended beyond the December 31st expiration date, and it was not. So it expired. So what are we seeing schools do in response?
All right, I'm going to pretend there's not a lot going on in my house right now, and I'll start the conversation first. I want to say first and foremost that the question we keep getting, and I've been dealing with, I swear, since we went back, since January 4th, is can we extend Ffcra? Can we, first of all, is it extended? And the answer is no. Can we extend it? And I want to be clear kind of when we're talking about this is that, Ffcra is not extended. It is expired. It's over. So whatever benefits you choose to give your staff, you are giving it as a benefit. And I certainly think with respect to if you're extending those sorts of leave rights, whether it's for childcare or what was called emergency sick leave, and we'll talk about the difference between those, to make sure that you are working with your unions on them for two reasons. One, you want to make sure that you're not later charged with that you were individually bargaining with a specific employee. And two, you should get credit for that. I mean, the employers who are doing more than they need to do by law or by contract, you should be making sure that that's documented somewhere and that there is something, a give and take related to that exchange. So I would say that to begin with. And I think when we look at those two pieces, whether it's the childcare portion or what was considered emergency sick leave, I think we should talk about the childcare piece first, because I think it's the easier of the two. And certainly the way that I have seen districts handle this is really with two different options. The first being that you allow the individual to work from home because these are people, just to be clear, that have a childcare issue, so that their school or daycare center is still closed, or that this hybrid schedule they have, for instance, is in conflict with the hybrid schedule or the fully in-person schedule of the district that they work at. And so that they're unable to return to their work site because of their kids at home. So the first option we have seen is districts allowing those teachers to work from home remotely. And the other option is for the teacher to take a leave of absence. And the one thing I want to caution about, and Nikki, I'll be interested to hear your thoughts on this as well, is that, if you are going to move to a model where you're going to be allowing these teachers to work from home, because quite frankly, you might be a staffing issue, if you don't do that, depending upon the numbers we're talking about. You need to make sure that all of the teachers or staff who may have requested to work from home as a medical accommodation are afforded that benefit first. So if you're only able to do it for a handful of employees, those are the employees who should get that benefit first, because otherwise you're going to be likely seeing claims under the Americans with Disabilities Act. So I just want to be clear about that part of it, that it might seem like a good option, but the number might swell a lot as to who you have to provide it to if you're looking at both of those groups of people. And then the second part of it, in terms of if you were alternatively going to say, well, we're not going to do that because we either, we can't do it for a staffing perspective and it won't be able to keep school open. If you're going to have teachers take a leave of absence instead, be sure that you're looking at what the agreement provides, because the collective bargaining agreements that I've seen typically you have very specific parameters around what an unpaid leave of absence looks like, when it has to be requested, how long it can be for, what the reasons it can be for, and this likely doesn't fall within that bucket of leaves. So making sure that you're putting an MOU together with the union that sets forth kind of what the terms are going to look like about allowing these teachers or staff to take that sort of leave of absence. And again, I haven't seen any districts that I work with say you cannot take that sort of leave. We know there is a teacher shortage. There's going to continue to be a teacher shortage, and we don't want teachers resigning if they don't have to, and alternatively can just be able to take a leave for the rest of the school year. Nikki, I don't know if you're seeing anything else.
No, I mean, that's exactly right. I mean, I think the childcare one is really causing a lot of consternation because, as you said, there's some districts that are, where it's just, it sort of is what it is. If you either come to work or, I'm getting a lot of districts who are just sort of at this point, they've got to get their schools open. And so they're sort of saying, look, find a place to put your children. Again, some districts are creating their own Zoom rooms or childcare options within the school building. We've definitely helped with some of those if that's an option you're considering. And others, as you said, they're looking to their CBAs to see if there are leaves of absence that they can grant, juggling all of these things, especially with childcare, because the childcare likely is obviously lasting longer than those who are quarantining because of COVID exposure. So there's not a lot of great options right now. Hopefully as we see more and more schools open, the childcare issues somewhat lessen, but I mean, we know that the schools that are opening are not necessarily the children's schools are not opening the same kinds of schedules. And so this remains an issue, but those are certainly the options that we're seeing out there for the childcare piece of it.
And then obviously we have the other part of it that I think is the more difficult assessment to make, and where we're seeing inconsistency among districts. And that is how to handle the individuals who need to take a leave of absence, a leave because they have either been exposed to, they're a close contact, or have tested positive themselves for COVID. And, I think that there are, Nikki and I have been talking about this, I think, for days in terms of, what are the different options available. And certainly, one of them is to afford that group of employees a specific number of additional days. They don't have to use their own sick leave to cover that period of time. And then just being mindful of that you might be giving that person more time than the others were afforded if they've already used the 10 days under ESL. So again, an issue to work with your unions. But Nikki, what else are you seeing with respect to that piece of it?
Yeah, I mean, I think that this is I just want to, before we talk about the examples, I think one of the things that we're balancing is the same stuff that we were talking about with the travel, right? Which is that you want your teachers to let you know if they have been exposed to COVID, or your staff, I should say. And they are potentially less likely to do that, particularly your support staff. Not that your support staff are more inclined to not be truthful about this, but they tend to have less leave time. And so the concern then becomes, if they don't know if they've been exposed, or there's a question that they don't want to start using their own benefit time up. And you're weighing that obviously again with the staffing issues. So I think what we are seeing is sort of a range of possibilities. So we are seeing districts that have sick banks, opening up the sick bank as a potential option to use, and working out MOUs with the union about if someone is exposed to quarantine outside the school building, they can access sick leave. We're seeing in combination with that or alone that if, for example, there's exposure within a school building Oftentimes if there's exposure within a school building and you say have to quarantine a whole class, you can move that class remotely. And so the teacher or the staff continue to work. But to the extent that folks can't work remotely, then you grant a certain number of leave days so that they're not using up their own leave days, right? Again, all of these different permutations have to be negotiated with your collective bargaining units. And, you should definitely, as Shelley pointed out at the beginning, if you're going to offer leave, get some benefit from it. Again, there's just a wide range of options, and you just have to figure out what works best for your district and what your union will agree to at this point.
And one thing I'd add to that, Nikki, is that, another question I've been getting often is, can we treat different groups differently? So can we treat different union groups differently, or can we treat a non-union group differently than a union group? And the answer to that is yes, depending upon what you bargain with, maybe you have two different units, or what you allow for your staff who are not in a bargaining unit. You really have to look at kind of all the details related to kind of what's happening. And as Nikki mentioned, since some staff have significantly fewer benefit days, one group might have a sick bank and the others does not, making sure that you're really taking all of that into account to be as fair as you can to the employees, but also to make sure that you're not incentivizing anyone to not be truthful about whether they have been exposed or not, or don't feel well coming into your school building, because that kind of can cause the whole thing to fall apart.
All right, so Nikki, that brings us on.
Sorry,
go ahead.
Oh, sorry, just Shelley, on the other side of that, so you don't want staff to be to expose people in the building, but I feel like there's a trend, there's a feeling in the community that teachers are not working and need to be working more. So the concept of, do you incentivize them to say that we're exposed or have COVID if you offer special leave for that? It seems like that is a growing concern that maybe wasn't there when we first started all this.
Yeah, and and I think you're right. I think it's there. We're seeing it now as remote platforms get longer and longer into the school year. There's more frustration, I think, about that and that position of some individuals. In communities in general. But I think that the way that we have found a way around this, and Nikki and I have talked about it before, is if you're going to allow that sort of leave, additional leave, that requiring that the employee take some of their own benefit time before that, so that they've got some, I'll call it skin in the game. They have to use 2 of their benefit days before you'll give them this additional kind of free paid time off. I'll mention another option here that I don't think we talked about is unpaid time off, but not use of benefit time, because people want to save their sick days, whether it's for their pension or what they should be using them for, which is when they're actually sick, because we all will get, sick one day and need to take some time off work. So the idea of allowing them unpaid time off that might not otherwise have been available to them during that period of quarantine. So that's another option as well.
Yeah, and we got a question in about whether we think that now that given the changes in the federal government, whether there might be an extension of Ffcra or a new version of it. That is definitely a possibility. We don't know at this point, but we'll certainly keep you posted as we hear, but yes, certainly a possibility.
So Nikki, circling back to that question that we used as a jumping off point to talk about this topic about, what happens if you have an employee who, doesn't want to take the vaccine, but then, needs that leave. So is it possible to treat employees that have had the vaccine differently than those who haven't?
Yes, first I'm just distracted because I want to know how Shelley managed to get her teenage son to vacuum for her while on this webinar. So that's wonderful, and she'll have to share that with us later. Yeah, you can certainly, as far as we can tell at this point, the EOC guidance suggests that it's not, suggests basically that if you want to incentivize getting vaccines, that there are some circumstances under which you could potentially offer staff a different level of benefits if they are accepting the vaccine. Obviously, you have to keep in mind that those who cannot get the vaccine for medical reasons or, for religious reasons, should not, be penalized in such a scheme. But certainly that's something to consider if, as the vaccines roll out, we'll start to see more of these permutations, and we can dive further into them.
Yeah, I am impressed, Shelley. There is a wild game of basketball going on the other side of this wall here, between my 6-year-old and my 9-year-old. I have not figured out how to get them to vacuum yet, so you're gonna have to teach me. All right, so then let's talk about testing. Let's switch gears a little bit and talk about testing. Can we mandate testing legally? So Jen, for students, staff, for the different subsets we're talking about here, what's our ability to mandate testing?
So I have talked about this a little bit before on webinars, just to give a caution. It's a yes, but I mean, our answer is going to be yes, there are ways that you can mandate it, but there's a lot of complication to that, and there's some risk to it. So before you would take that as a hard yes, so to speak, please reach out to one of us and work with us on the nuances to that yes. But it is a yes. Some of the challenges we're seeing where testing is mandated is around things like community perception, as far as if students are mandated but not staff. I would say legally there are ways to mandate for both student and staff, but staff, it becomes a bargaining issue. And I think we're seeing that even though there's hoops one needs to jump through to mandate for students, those are a little, they're actually legally more complicated, but maybe more logistically feasible to work through than the bargaining. So we're seeing some districts mandate for students and not staff, and that to communities has gotten a reaction. I'll just put it that way. So it's complicated. I was telling this group, my own daughter started the safeguard test, and I could not get her to spit. She's apparently unable to spit. I didn't know this until today, but I was thinking, if this was and I've been, of course, advising all these districts, you can mandate it. And I was thinking, if this was mandatory, I would have been absolutely desperate. I mean, I was already pretty frenzied to try, like, spit. I don't know. I was like, gonna scrape it off her tongue or whatever, like just any way to get spit out of my daughter's mouth. But I thought, my God, I definitely would have falsified. I know we're going to talk next about the untruthful parent. I absolutely, if it was mandatory, would have spit for her to get her to go to school. So I'll just confess that. Nikki and Shelley can say what you would do to me if I went to different districts. But anyway, so legally, yes, I am now finding all kinds of practical concerns with this. I'll leave it there.
I think we were all up very late watching the news last night, and it is quickly apparent. I was just going to jump in. I know the next question was just to quickly remind ourselves of the types of the testing out there and the requirements. And I think we've talked about this quite a bit. I also would again highlight that IASA has done a couple of different webinars now with some of the superintendents, including Victor Simon from Gower, who have really led the way on this. There's lots of different testing out there, get very confusing. So certainly if you haven't set up a testing program but are interested in, definitely reach out. For the safeguard testing, which Jennifer was so eloquently talking about just now, and spitting, there's an agreement with Safeguard that we have worked out that I think really is a good agreement. So if that's something that you guys are interested in, definitely reach out. And there's consent forms that go along with that. The BINEX test, which is a different level of testing, which is the rapid nasal swab antigen test, requires a whole nother level of legal requirement compliance. So you have to get a CLIA waiver, you have to have a program that has all sorts of documents. So if you're going to set up a BINEX test process, please let us know. We're happy to. We have all of the template documents that you're going to need. One note for those on the call that are from DuPage, I know one of the stumbling blocks for BINEX has been to get a standing order from the county health officials. So certainly trying to think about trying to think about whether we can work with the county health officials to assist districts with that piece of the puzzle. But again, if you're going to set this up, we're happy to help. Certainly districts are using these tests in a variety of different ways and can be very useful to a safe return to school.
We're having, I'm laughing in part because Nikki is so funny and clever, but I'm also laughing because we're having a really cute conversation with a number of you in the chat here about a lot of different topics. But one thing I did want to point out is that tax credits were not and continue to be unavailable to school districts. So there's been a little bit of chatter back and forth about, there's a lot of people saying that maybe these are available and the unions might be saying it, and that hasn't changed. So just wanted to bring that up. All right, so Jennifer mentioned earlier that we were going to talk about the issue of people maybe being untruthful. And so we have heard concerns from some districts about parents being untruthful on self-certification forms. So Shelley, what can you tell us about that?
Okay, two things. Well, before I get started, I want to just clarify for everyone listening and my fellow panelists, he was not vacuuming. He was using the blender because it is lunchtime at my house. And I think we've been doing these for like 40 weeks or maybe forever. I don't know, on Thursdays at 12 o'clock. And you'd think my family would know this by now, but yet he's a 14-year-old. So back to the issue of lying on self-certification. We have a superintendent who did respond in the chat suggesting to Jen how she could not lie on the certification because it's apparently drooling, not spitting. Thank you, Martha, for that. But we have certainly heard concerns from a number of districts about how do we ensure that parents are being honest on the certification form. And we understand the concern. We certainly do. And I know that there are some districts that have put out notices to parents, letting them know that there could be consequences if they're found to be untruthful. And I say that really carefully because for a few reasons. And the first being, how are you going to know for sure that a parent is being untruthful? I think there's only going to be very extreme circumstances that would provide enough evidence, I would say, to determine that a parent has actually been intentionally untruthful, other than Jen just admitting it to the over 100 of you watching. So if it's her district, well, it's a little different, but you have to be careful about that. And you also, we were having a very robust discussion before we got started today about whether or not you could actually kind of punish the child for the sin of the parent. So if a parent is untruthful on the certification, can you then require that the student be put on the remote program? And I think we have very differing views as to how to handle this. I think like I said, I think this only happen in the most extreme circumstances. I think there's steps that you can take if you feel a parent is being untruthful, such as if there's a self-certification they've done at home, that student or students be screened at school, whether it's taking their temperature or asked a number of questions. You could make sure that's happening at school as opposed to at home, certainly, especially if a parent is not complying entirely. So that would be one alternative. But Jen, I know also it's a kind of a gen ed as well as a special ed issue. So I don't know if you want to comment further on that piece of it.
Yeah, well, the move to remote learning, we've talked about, and has whether or not that's a placement issue. I think that I've had conversations with Idph where even though we've tried to say that they're equivalent, I think it's pretty well thought that remote is not as good as in person. And so even though we're saying we're still offering you an education, it's just remote, that is a little, I think there's still risk there that they're not equivalent. And so this is a punishment of the student in a way. It is a discipline or, and then when we have special ed students, again, we have the argument that these are modalities and not placement changes, I think is the right legal argument, but it is so much more difficult to implement IEP services remotely than in person, that it becomes an implementation issue, not an illegal change of placement. So for all those reasons, I mean, I get nervous when I hear this, and we've talked about, I mean, it might be an effective threat that you don't carry out. Don't let them watch this webinar and hear your attorney say you might not carry it out. Maybe you will carry it out. It's a real threat, but it might be one of those things that it's a communication issue, and hopefully you don't have to actually do it. And then before actually doing it, really drilling down to the specific student, what's going on, does the student have an IEP, are there other complications, because I think there's risk here.
Yeah, and I'll tell you, I mean, I think that I agree with you. I think there's legal risk out there. The question, and I think we said this honestly kind of on the first webinar we did, you all have to balance what that risk looks like. I mean, is there's a public health crisis out there and you want your kids back in school, and what risks do you have to take to make that happen? And this might be one of them. And I'll say that it's not just parents being untruthful. For the reasons we discussed earlier, we may have staff being untruthful because they don't want to use their benefit time, or they don't want to have to be out on unpaid leave. So I would make sure that in that instance that you're clear up front about if they are found to be untruthful, what the consequence for that is going to be. Because I mean, that is also something that we're seeing happen. And again, not often, but it does happen. You want to make sure that you're planning for that also.
All right, Jen, we promised earlier that we were going to give a little bit of information about our new or soon to be new Secretary of Education. So can you give us a few thoughts on that?
Yes, so the new nominee is Miguel Cardona, the Education Commissioner in Connecticut. His background is that of a teacher and then an assistant superintendent for teaching and learning. He co-chaired some task forces, one on achievement gap and another on birth to grade 3, so younger student initiatives. So when we had talked before we knew who the appointment was, there was a lot of chatter about, is it going to be maybe a union leader, an education leader from the unions? This really directly went kind of the other direction. It's someone in administration, also though with a history of being a teacher. He's around our I think I saw he's pretty close to my age. I think he's in his 40s. Not necessarily a high profile, like someone who I think will be known or immediately draw arrows just based on reputation, a little bit more of an unknown, leader in his state. So interesting choice and should have a good perspective. I mean, he definitely worked in the public schools, so not from higher ed. There's also discussion about an appointment from higher ed. This is squarely someone with K-12 experience and looking at elementary education, and so interesting choice.
Yeah, and interestingly, not someone we had listed in our Biden webinar, but that is why we are in the legal business and not the prediction business here at Prince.
I do think that there was an article that came out like an hour after our Biden webinar from the Washington Post that included his name. So, All right, we had a question, Nikki. The new stimulus money, December 2020 passed by Congress. Is there any word on what it can be spent on? Also, deadline for all spending.
Yeah, I haven't seen a deadline. I'd have to look into the deadline issue, but the issue in terms of what you can spend it on is it's very broad, just like the original CARES Act money was. So pretty much whatever you're going to spend it on in terms of helping students, is it technology, remote education, remote instruction, supporting students that are low incomes, children with disabilities, students, Black and brown students that are experiencing homelessness, EL students, any efforts to address learning loss, any mental health services. I mean, really, I think you're likely whatever you're thinking about is going to fit into one of these buckets.
All right, we did have a few questions about TRS and the impact of Ffcra now that it's over. If you grant leave, what happens? So I just want to say that you should go and look at that bulletin. Contact us if you'd like more information. TRS put out a recent bulletin, indicated that it will treat payments like paid administrative leave. And so leave will be considered creditable earnings to the members. And it's also up to the school district to ensure that all of the required documentation and standards are met. So sorry to rush through that, but we are out of time. We do thank you all so much, as always, for joining us. please do check out next week the first part of our equity webinar series. We'll be doing once a month during this time slot, a webinar focused on equity issues. So please do join us for that. And we will be back soon with more on COVID. So as always, please continue to send us any questions you'd like us to address. Thank you so much for joining us, and take care, everyone.
Thanks, everyone.
Bye.